There's something about breathing and getting oxygen that's very good for your survival. And when you don't have enough oxygen, it can really put a person into a panic attack or an anxiety attack. So today we're going to talk about difficulty breathing or air hunger, or another term for that is dyspnea. And traditionally, people know about this symptom coming from asthma or some type of pneumonia or lung infection or COPD, or maybe anemia or even a heart condition. But what if you don't have any of those problems, right? You rule those out and you still have this problem with your breathing, which can really affect your ability to sleep. There's some great information on this topic by two people, Craig Stewart and Steve August. And I'm going to put a link down below for their video because they have some really great data on this topic. You could probably call this condition pseudo-dyspnea, which is kind of the opposite. When you rest, it gets worse, but when you exercise, it gets better. So let's cover the 4 main reasons for this condition. The first reason, which actually was Craig Stewart's reason, he had something called silent reflux, where there is some acid regurgitating up through his esophagus, but the silent part means that you don't have the heartburn, but you might have some of the other symptoms, and you might not even feel them as well because they're silent, but they're there. So what does acid reflux or silent reflux have to do with your breathing? Well, apparently there's a lot of sensory nerves in your esophagus that go right to your brain and that will give your brain certain information that it's not getting enough oxygen, which will cause you to feel like you have air hunger. It'll cause you to breathe more and gasp for air. It'll cause you to yawn more. And when you breathe more, sometimes it creates almost not like a hyperventilation, but you get too much oxygen and not enough CO2. Okay. Now, you would think that would allow you to breathe better, but what's interesting about the relationship between oxygen and CO2 is that you need a certain level of CO2 to allow oxygen to go into your red blood cells. And so if you have just straight oxygen without enough CO2, you won't be able to get enough oxygen into the cells. So you need this balance. So this extra breathing actually doesn't help oxygen going into the cells. And so Craig's solution was to take a certain medication to heal the esophagus, right? And try to get rid of some of this silent reflux, and that tended to help him. My solution is going to be a little different because it's going to involve not taking a medication, but just finding some chlorophyll. You can also use some wheatgrass juice powder, and you can put it in some water and drink that a few times during the day on an empty stomach to have that chlorophyll line the esophagus and slowly heal those tissues over a period of time. That's also a good remedy if you have an ulcer or gastritis, because you need to heal that before you really can correct the underlying cause, which, by the way, ironically, is not enough acid. A weak acid in your stomach will cause the valve on the top of your stomach to open up too much. It won't close. And what'll happen is acid will regurgitate. You'll get GERD, and it kind of comes up through the esophagus. So most people, logically just take an antacid. When in fact, if you took an acid like betaine hydrochloride or maybe even apple cider vinegar, you may find that those symptoms go away because now that valve can close. In other words, a lot of the heartburn, especially indigestion and acid reflux and GERD, comes from a lack of acid, not an excessive amount of acid. Now, you're feeling the acid coming up through your esophagus, but the actual stomach part doesn't have enough acid. I mean, if you just think about this logically, this concept of acid reflux or heartburn being too much acid or too acidic, well, what is the normal pH of the acid in your stomach? What should it be normally? Well, it's at the bottom of the pH. That's super acid, like between 1 and 3. That's like battery acid. And so you think your acid reflux or your heartburn is coming because you have like more acidity or too much acid? Well, normally you should have that acid to break down the protein. So it doesn't really make sense that it's too much acid when you really know and understand the real pH of your stomach, a normal pH. And also the treatment and acids dilute the acid, making it weaker, and then think about all the consequences of that, not being able to digest protein. So anyway, if you have this difficulty breathing, this air hunger, really assess, do you have this silent reflux? Do you have a digestive issue? And so if you do have this irritation in your esophagus, obviously you don't want to add more acid. You want to take some chlorophyll. That will help it. But if you don't have that and you still have acid reflux, then you want to take betaine hydrochloride, like 5 before a meal, and maybe some apple cider vinegar diluted in water, drinking it through a straw. But here's the other thing I want to mention about this, and that is called alkalosis, okay, where your pH becomes too alkaline. And you have two types. You have the metabolic alkalosis and also the respiratory alkalosis. Interesting. Both of these conditions have a indirect or direct effect on the CO2 again. So when the pH of your blood changes, it affects your CO2 and your oxygen and your breathing. Where does that come from? Well, one cause is you're losing your stomach acids. When you have a condition called achlorhydria, which is a lack of stomach acids, or even hypochlorhydria, which is a diminished stomach acids, one of the side effects is an alteration of your pH. Your body becomes more alkaline. You could have breathing problems from this damaged esophagus issue. You can have breathing problems also because you have this heartburn issue or a lack of stomach acid, which it affects your pH, and that alone can cause you to have air hunger. Again, the same solution is to acidify the body. And betaine hydrochloride and apple cider vinegar can help do that. The other cause, and this is something that I see quite frequently, is a problem in the tubes that connect to the gallbladder from the liver and that go into the small intestine. And those tubes are called bile ducts. And a lot of times those tubes can be filled with bile sludge. This causes like a lack of flow through those ducts, not necessarily even developing a stone. It's on the road to developing a stone, but it hasn't developed a stone yet. Usually it's just sludge, and it's really hard to diagnose. But the point is that when you obstruct those ducts and you don't allow the flow of bile to go through, it backs up into the liver and it swells up around the gallbladder, and it affects the diaphragm, which is right underneath the rib cage. And it can also affect the phrenic nerve. Basically, it's a nerve from your neck to the diaphragm. Now think about what breathing problems involve, right? The diaphragm. So you have this gallbladder / bile duct issue, congestion, whatever you want to call it, that backs up that breathing apparatus. And that can affect your breathing big time. And this usually can be easily corrected by changing your diet to the healthy version of the ketogenic diet with intermittent fasting. But as an immediate remedy, you want to take something called TUDCA. It's a type of bile salt that is very unique because it helps to increase the flow of bile sludge through the bile duct. So you would take 2 of these in the morning on an empty stomach, and then 2 in the afternoon on an empty stomach. And then within a few days, you'll just feel a lot better if that is the problem. Now, you can go get a functional test to look at this and assess it. It's very, very expensive. A much cheaper way to do it is just to buy a bottle of TUDCA and then just take it and see if that doesn't solve your problem. You just saved a lot of money. So that's cause number 2. Cause number 3 was discussed by Steve August, which I'll have that link down below. And that is a problem with your ribs and the articulation to your back. Okay, because a lot of times this breathing problem is associated with costochondritis, which is inflammation in your rib cage on the front part, which can mimic a heart problem. But really the problem is in the back part, right? So you have the spine, you have all these different ribs that connect to the spine, but this articulation between the rib and the spine in your back, if it's restricted, can affect your breathing very easily. Now, how could that occur? Well, easily from an injury. I personally had many injuries to my back. I remember when I was in 6th grade in football, the coach actually surprised me and ran into my back, knocked the wind out of me. I don't know why he did that, but ever since then, I had this damaged middle thoracic spine issue. Another time is I broke a rib in the back. Another time, I broke a rib in the front. I've had a lot of damage through wrestling and other injuries, motorcycle accidents to my thoracic spine. And so what happens when you had that, not to mention car accidents as well, and falls and blows and things like that, you develop scar tissue around the joints. And so you go to the chiropractor, you might get adjusted, but it doesn't last very long because they don't really stretch out that scar tissue that is involved in the articulation between the rib head and the spine. Okay, they just might give you an adjustment, but it doesn't go further more out to the spine. And so there's a couple different devices and techniques that you can get to massage your spine. And I will put that link down below, but also stretches to your thoracic spine, rotational stretches back and forth. I like the mobility stick, which is a great tool that you can get into these positions and stretch your spine really good. I'll put that link down below. So if you have this problem, you can start stretching and expanding this rib spinous connection that's affecting the lungs. In other words, if you have an old injury to your thoracic spine, or let's say that you spent years hovering over a desk and you have poor posture, boy, does that affect your breathing in a big way. I have that problem. And so I have to work at expanding my rib cage by doing all these stretches and using certain devices to do that. And then the last cause of this thing is from COVID, a long haul COVID symptom of difficulty breathing. Here's the thing. If you have the COVID issue and you have this difficulty breathing, the remedy for that is higher levels of thiamine, B1, because vitamin B1 is intimately involved with the brainstem, which is your breathing centers. And so that is the remedy for breathing. So in this video, I covered all 4 reasons why you might have this kind of pseudo breathing problem that's not related to your heart or lungs directly from some type of disease state. There's a very interesting and helpful video on what you should eat to solve that problem involving cabbage. Now, because of the censoring and the suppressing of the algorithms on YouTube, it's becoming more difficult to find my content. And there's a lot of content that I cannot put on YouTube, unfortunately. So to make sure you have full access of all my information, go to drberg.com and subscribe to my newsletter by clicking the link down below in the description. I will see you on the other side.